AIDS is no longer the death sentence it once was, but it has hardly gone away. 40 to 80,000 cases of HIV infection are reported in the United States each year. Half of those are people younger than 25. To find out how to prevent the spread of HIV among youth, let's welcome Gregory Gross, Clinical Manager of the HIV Testing and Prevention Program at the Center On Halsted in Chicago. Greg is also a commissioned deacon in the United Methodist Church. Thanks for being here, Gregory.
Thank you.
First of all, tell us what the Center On Halsted is.
Well, the Center on Halsted is the Midwest's most comprehensive and largest community center for the LGBT community. And so we have a wide range of social services, but also community and cultural programs. So we have a youth program and we have a senior program. We have mental health services. We also have a theater program. And I work then in the HIV testing and prevention program. Okay. And so we provide HIV testing and we run HIV support groups. We also run the state of Illinois' HIV, AIDS, and STD hotline for the entire state. So we get calls from all over the state and the country and now even the world.
It sounds like a busy place.
Yes, very much so.
So we're hearing these statistics about the young people. Mm-hmm. Who are young people that come to the Center on Halsted?
We see young people who come from all over the city and the suburbs, honestly. People who come for testing can be 13 and over and come and get a free test. And so we see young people from 13 to 25. We also then see people up until their 80s and 90s, actually. Okay. But we also see a large majority in the youth program. We see 200 youth a week. And from those, 70% of the youth are youth of color. Okay. And then 30% of them are homeless. That's in the youth program. In our testing program, we see youth, young adults from all over the city and suburbs. Yes. Okay. Mm-hmm.
And for these younger people, is there a common theme in what their major needs are from the center? The testing, obviously.
Yes, for the testing, something that we do is we do enhanced counseling. Okay. So rather than coming to your doctor and just coming in and getting blood drawn and being called later with the results, we'll sit and talk with anyone actually about their risks. Mm-hmm. So we do a lot of sex education, but we also do a lot of risk reduction conversation as well.
I'm 13, I come to your center, my parents, it doesn't sound like, are probably with me. What if I test positive? What then?
The law in the state of Illinois says that you don't have to have parental consent to get an HIV test. It can be anonymous, it can be confidential. If they do come and it is positive, before we've even done the test though, just take a step back, we do have that conversation about what would it mean for you if this came back positive? Who could you talk to? Because we've had people who say, I would go out and hurt myself. I would go hurt someone else. And so we're not going to do the test right then. We're going to do some more counseling and education around HIV. So like you said earlier, let them know that HIV/AIDS is no longer a death sentence. Right. But if it does come back positive, I'm also a licensed social worker, so I myself can be right there and provide support, some clinical support and counseling. We then also offer not only right then, but 2 to 8 sessions for free for someone who tests positive.
Oh, that's wonderful.
Yeah. I also then oversee the HIV support groups so that we can help wrap around services and then make referrals for case management so they can get medical care, even if they don't have insurance.
Okay, that was my next question.
There we go.
What are the best ways we can teach kids to prevent HIV in the first place?
Well, that's a great question in that I think it's always changing. Mm-hmm. But right now, I think something that we need to be doing, especially as a church, as a religious community, is talking about sex in general. It's something that is still, in many societies and many cultures, it's taboo. We just don't talk about it. And so if we can talk about it in a more holistic way, I think that's really goes a long way towards prevention. But then also letting know that HIV is no longer the death sentence. It once was, like you said. The epidemic is changing. Right. You know, oftentimes we think about HIV/AIDS, we think of gay men only. It's still on the rise here in Chicago among young gay men, very much so. They're disproportionately affected, especially gay men of color. But it's also on the rise among young African American women, who are also disproportionately affected. And so I think something we have to do is tell the facts so that everyone can know what's going on, and that anyone who has sex, anyone who shares needles is at risk for HIV.
No matter your orientation or where you live.
Exactly, exactly. Whether you live on the south side, whether you live in the North Shore, you can be at risk.
Are there things that churches near the Center on Halsted are doing to be involved in this support?
Oh, very much so. A lot of the churches around the Center on Halsted, in Lakeview, in Lincoln Park, in Lincoln Square, they are reconciling, they're open and affirming, they're accepting, welcoming of LGBT people, which is wonderful.
It's a big step.
It's a very big step.
Thank you, Gregory. I'm Polly Toner for Different Drummers. Keep the faith.